Hello and welcome to this module on foundations of public health, part of the course on controlling infectious diseases in Idaho's communities, basic public health principles, put together by the Idaho Collaborative for Infectious Disease Prevention. I am Dr. Namdi Moiteke with the Department of Community and Public Health at Idaho State University. So we'll begin with the first unit, Principles of Public Health Practice. And we'll ask, what is public health? There are a range of definitions. Most leading public health organizations like the World Health Organization and the Centers for Disease Control and Prevention and the Faculty of Public Health of the United Kingdom have all produced similar definitions. But the most widely used is probably that of the World Health Organization, which defines public health as the art and science of preventing disease, prolonging life, and promoting health through the organized efforts of society. And why is it an art? It's an art because simple facts and statistics will not achieve the gains that we need. A pragmatic approach is needed to achieve gains for health, and that is in itself an art. Organized efforts of society, because public health work is not carried out in isolation. Two conceptual frameworks are commonly used to describe public health. The first is the three domains, which expresses public health in terms of three overlapping domains: health improvement, health protection, and health services. Health improvement is simply the process of enabling people to increase control over and improve their health. Health protection, on the other hand, involves safeguarding the population against a wide range of threats to their health. And health services relates to the population aspect of healthcare and involves assessing interventions, programs, and services to ensure that they meet current and future demand in a clinically effective, cost-effective, equitable, highly quality, and safe manner that is also responsive to the needs and expectations of patients. So right here, we can see the picture of the three domains of public health: health improvement, health protection, healthcare public health. The second framework, developed by the CDC, describes three core functions of public health: assessment, policy development, and assurance, which are broken down into 10 essential services. These are not a prescription for what public health agencies should be doing. In fact, many people can think of several examples of work that agencies should be doing outside of what are comprised in these services. Instead, they are meant to serve as a tool to describe what every individual in a population should have access to, what public health services should be provided to the people that live within a catchment area. And what is health improvement? Health improvement, sometimes referred to as health promotion, is a more modern term. According to the WHO, it is the process of enabling people to increase control over and to improve their health. This was enunciated in the first International Conference on Health Promotion held in Ottawa, Canada in 1986. In this conference, the World Health Organization laid out guiding principles for health promotion. The diagram below represents the approach to health promotion outlined in the Ottawa Charter. So the small circle symbolizes the three core strategies of health promotion, which include to enable, mediate, and advocate. And the three wings show the 5 key action areas: building healthy public policy, creating supportive environments for health, strengthening community action for health, developing personal skills, and reorienting health services. Health improvement encompasses a broad range of activities policies, or interventions, all of which can be referred to as programs. These programs range in complexity from stop smoking posters in a doctor's office to designing health promoting urban environments. So health improvement programs include health education, which influences people's lives, attitudes, and behaviors with a view to encouraging them to make healthy choices about aspects of their lifestyles. For example, educating the public about nutrition and healthy eating. It also includes campaigns to raise public awareness about certain issues, for example, with respect to smoking and physical activity. Also involved in health improvement is social marketing, which uses the techniques of commercial marketing to sell a health message to a target population group while understanding the attitude and beliefs of the specific population group and tailoring a message that is most likely to be influential. Also involved in health improvement is legislation and regulation. For example, banning smoking in public places, mandatory use of seatbelts, taxing unhealthy products such as alcohol. Community development and empowerment is also involved in health improvement, which engages a target population in the developmental delivery of a health promotion activity. Also involved in health promotion is behavioral change techniques, including various initiatives to promote healthier lifestyles, such as increasing breastfeeding uptake, reducing car usage, etc. Health improvement programs can be developed and implemented at three levels: micro level, meso level, and the macro level. The micro level typically delivered to individuals on a one-to-one basis. For example, a health professional counseling a patient to quit smoking. The meso level involves health improvement activities delivered in a community or organizational setting, such as a school, a university, a workplace, or hospital. Examples include providing mental health training to teachers. At the macro level, we are dealing with regional, national, or international programs. For example, legislation to ban smoking in public places. Health protection includes efforts to safeguard individuals and the public from cases or outbreaks of communicable diseases and from non-communicable environmental or man-made hazards. So communicable diseases are controlled essentially through four means: prevention, surveillance, isolation, and treatment. Preventive measures depend on the particular communicable disease. In the case of food poisoning, it will include ensuring a secure supply chain, good hygiene, and thorough cooking of food. Surveillance entails close monitoring for trends or emerging outbreaks. Surveillance is defined by the CDC as ongoing systematic collection, analysis, and interpretation of health data essential to the planning, implementation, and evaluation of public health practice, closely integrated with the timely dissemination of these data to those who need to know. Isolation involves keeping a person with a contagious disease away from all other people or modifying contact procedures so as to prevent transmission to other persons. And treatment entails administering appropriate therapy or supportive care to those who are affected. Another aspect of health protection is emergency planning in response to non-infectious agents. This is a wide discipline, and health protection is one of many teams involved, such as ambulance services, the police, politicians, etc. Major incidents are situations which cannot be dealt with using routine service arrangements and require special procedures which health protection specialists plan for in advance. A major incident can range from a localized chemical spill to a mass casualty situation. Each situation is different and each must be planned for. Who does health protection, we might ask? The responsibility for controlling communicable diseases through effective prevention, surveillance, isolation, and treatment is typically held by a national government organization, which in the United States is the Centers for Disease Control and Prevention, the CDC. It is the principal agency responsible for health protection and emergency planning. However, not all health protection work is national. Emergency planning and response relies heavily on local services and businesses, including first responders, local public health teams, and support services. Finally, communication is vital to health protection and emergency planning. Appropriately managing the media and public communications is essential in controlling the story, offering support, and keeping the public sufficiently informed. This requires a delicate balance. Then we'll move over to the next component of the framework, which is healthcare public health or healthcare services. Public health plays an important role in supporting and advising health services from a population perspective to ensure they are meeting current and future demand, clinically and cost effective, equitable, of high quality, safe, and responsive to patients' needs and expectations. This is done primarily through advice, evaluation, healthcare needs assessment, and service design and delivery. Healthcare public health operates at 3 levels. Level 1 entails social protection, and this operates at the policy or macro level. It includes working at the national level with politicians, advocating for financing, and managing impact of policy on the healthcare system. Level 2 operates at the health system level, and it involves how it is structured and organized. It entails advising health systems, the healthcare system planners, the managers, and decision makers on how best to meet population needs across the country or region. For example, designing a blueprint for a polyclinic rollout, developing guidelines for practice, or assessing the cost effectiveness of new technologies. Level 3 is the health services themselves. So how individual healthcare providers operate, whether in primary, secondary, or tertiary care, and includes developing and enhancing patients' pathways, trying to opportunistically building health improvement programs such as vaccination and screening. Now we'll talk about health intelligence. This 4th domain underpins the other 3 domains. Health intelligence is the area of public health practice that deals with the management, analysis, and interpretation of data to support improvements in population health. Because it supports the other 3 domains, it is usually varied. Examples of health intelligence activities include surveillance, like we've said before, is the monitoring routinely collected health data to identify trends. Analysis, which is collecting and collating data, contextualizing findings, and synthesizing recommendations. Evaluation, which is asking whether or not your intervention worked. And data management, which is developing and managing ways to appropriately protect and leverage large volumes of data for population health gain. Health intelligence operates at different levels, from international and national levels that enable comparisons between countries and health systems, to local hands-on intelligence that seeks to leverage local data on a human scale. Next, we talk about the history of public health. And the first person we'll be looking at is Hippocrates. who lived between the years 460 and 370 BC. In Western medicine, the origins of public health is traced to Hippocrates, a Greek philosopher and physician. He was the first to reject the supposition that disease came about by supernatural causes. By close observation of patients, their symptoms and circumstances surrounding their illness, he was able to draw profound conclusions that were ahead of his time. He observed the way patients' lifestyles, their living conditions, and the wider environment impacted upon disease. He also recognized the role of sleep, diet, exercise, and work in preventing and sometimes reversing illness, much like we do in public health today. Hippocrates' thinking dominated Western society for centuries. The ideas of prevention and healthy lifestyle continued until the 18th century European Enlightenment. Before then, though, the Romans made significant steps towards making advancements in the field of public health as we know it today. As the empire expanded, they recognized and addressed the need for clean water and sanitation. They embarked on huge infrastructural projects, building aqueducts to transport clean water to towns and cities, public baths, and a network of sewers. We look at also the contributions of Claudius Galen, a physician, writer, and philosopher. He became the most famous doctor of the Roman Empire. He studied the work of Hippocrates, but made advancements in medicine through empiricism rather than relying on the rationalism, the idea of reasoning alone. He started the experimental method in medical investigation. In medieval Europe, the practice of quarantine began in Venice, Italy, during the 14th century at the time of the Black Death that was caused by a bubonic plague, which killed almost 30% of Europe's population. To prevent its spread, ships arriving from infected ports were required to sit at anchor for 40 days before being permitted to enter cities. This practice was later applied to many other diseases. Next is Edward Jenner, who lived from 1749 to 1823. He was a physician from London who developed vaccination. Smallpox, which is now eradicated, had for centuries been prevented in China and Sudan by a process called variolation, which entailed giving someone a mild dose of smallpox, typically tissue from an infected person, with limited safety, though mortality was substantially reduced in those who received variolation than those naturally exposed. In 1794, Jenner found that inoculating people with cowpox, which is a related virus, conferred some immunity to smallpox and was very much safer than variolation. Sir Edwin Chadwick led the 19th century hygiene movement. He was an English social reformer who worked on reforming the poor laws and improving sanitation and public health. John Snow, an English physician, considered the father of modern epidemiology. In his days, cholera was assumed to be airborne, but this miasma or bad air theory was rejected by Snow, who believed that cholera entered the body through the mouth. There was an outbreak of cholera in Soho, central London in 1854. Using careful investigations which involved plotting the famous cholera cases on a map, John Snow identified a water pump in Broad Street as the source of this outbreak. His theory was proved when he had the hand pump removed, and the number of cholera cases immediately began to reduce. Louis Pasteur was a French biologist and chemist who demonstrated that food went bad because of contamination by microbes in the air. He's considered the father of microbiology. His germ theory has been monumental in the prevention of disease since then. He's famous for discovering the pasteurization method that killed bacteria in wine and later milk. He also developed the first vaccines for rabies and anthrax. Florence Nightingale was a nurse in the Crimean War. Although she laid the foundation for the professionalization of nursing among women, it was actually her mathematical genius that enabled her to save so many lives. She became a pioneer of visual representation of statistical data. Her famous Rose diagram, or coxcomb, clearly illustrated the seasonal sources of patients' mortality in the Army Field Hospital where she managed. The diagram showed a 99% decrease in deaths following the work of a sanitary commission. Its publication led to the establishment of new Army medicals, sanitary science, and statistics departments that improved patient safety. Joseph Lister pioneered sterile surgery. Hygiene and cleanliness were found to be associated with fewer post-operative infections. Sir Alexander Fleming was a scientist and physician. He discovered penicillin, the first antibiotic, in 1928. Sir Richard Dole was a physician and epidemiologist. Along with co-researcher Sir Austin Bradford Hill, he characterized the effect of tobacco smoking on a range of health issues, including lung cancer. We want to look at the public health governance in the United States. In the United States, state and local health departments retain primary responsibility for carrying out public health functions under the U.S. Constitution. There are 50 state health departments, as well as one in the District of Columbia, over 190 tribal health departments, over 2,500 local health departments, and 8 health departments for the U.S. territories and freely associated states. Directly serving the population are primarily the local health departments, which are overseen or governed by state health departments, which are in themselves overseen by federal health agencies. Federal health agencies primarily interact with the state health departments, both in terms of the provision of funding or resources, but also in the establishment of guidelines or policies. They also have some interaction directly with local health departments, and to a lesser extent, directly with the population being served. Now, the state-level health departments are the ones that primarily interact with the local health departments. These county or city health departments receive funding, resources, and support from state health departments. State health departments interact with the population mostly indirectly through the local health departments, but in certain situations, they interact directly with their catchment areas. This map depicts the somewhat complex mix in the United States as regards whether an area is governed primarily by local health departments, state health departments, or some sort of combination. You can see the green or light steel blue states like Idaho, in which all local health departments are units of the local government and are primarily led by employees of the local governments. There are the dark blue or Dodgers blue states, in which it's the state health department's responsibility to provide health services for their states, and local health departments are primarily led by employees of the state. In the navy blue or orange states like Kentucky, Georgia, and Florida, there is a shared structure where all local health departments are governed by both state and local authorities. Finally, in the violet states, there is a mixed structure. Some local health units are led by employees of the state, and some are led by employees of the local government. We'll be looking at public health ethics next. Ethics is a system of moral principles. It's a set of social or personal values. It is these principles and values that affect how people make decisions and live their lives. Ethics is also described as moral philosophy, as it is concerned with what is good for individuals as well as society as a whole. This moral philosophy covers dilemmas such as what is right and what is wrong. What are the rights and responsibilities of individuals, organizations, and society? On first thought, you may think the difference between right and wrong is clear. For example, most individuals would agree that it is wrong to steal or kill another human being. However, there are many scenarios that are far more contentious. For example, human rights, abortion, euthanasia, war, animal rights, capital punishments, and others. These topics are widely debated. Ethics provides us with a set of principles and tools to think about such moral issues. Let us consider the second major dilemma. What are the rights and responsibilities of individuals, organizations, and society? We may ask, whose responsibility is health? Is it purely a matter of individual choice, or do organizations have a role to play? What should be the responsibility of governments and businesses, employers, schools, and health professionals? What should be their roles? A central ethical dilemma in public health is balancing individual liberty with the collective responsibility of society to improve health. There are different views about the extent to which health is an individual or collective responsibility. John Stuart Mill, an English philosopher and 19th century civil servant, set out his position on the role of government and opined that the government should be constrained. His famous Ham principle states that the only purpose for which power can be rightfully exercised over any member of a civilized community against his will is to prevent harm to others. In other words, the only time someone's choice should be curtailed is when that choice harms someone else. This is quite a high threshold for intervention. So you may not agree with Mill or the role of government, and many people in public health tend to advocate for more interventionalist approaches to challenge unhealthy behaviors. But it is good to highlight the Ham principle as a starting point. More conventional medical ethics is based on 4 principles: autonomy, which is the freedom to act independently; non-malfeasance, which is do no harm; beneficence, which is do good; justice represents fairness. These principles are well suited for guiding the relationships between healthcare providers and consumers of healthcare. However, the emphasis that medical ethics places on autonomy conflicts with a number of public health principles. So, unlike medical ethics, public health ethics recognizes that there will be circumstances when the health of the wider population justifies overriding the autonomy and rights of the individual. Let us look at a public health example: obesity. Obesity, like many of the prominent public health challenges of today, is considered a lifestyle problem. However, in public health, we don't accept that individuals are obese as a result of their personal choices alone. There are a number of other important factors, including social and economic living standards, the built environment, availability and access to preventive and curative services, and the availability of healthy food. Many public health interventions to tackle obesity are delivered at the population level and thereby affect individuals that are obese or at risk of becoming obese. Examples include increased taxes on high-fat, high-sugar foods and drinks, mandatory physical activity in schools, and restrictions on the advertising of fast food in public places. If one were to apply the medical ethics framework to this example, the proposed public health interventions will be likely deemed unethical due to their infringements on public and personal autonomy. In terms of positive goals, public health should reduce the risk of ill health people might impose on each other, ensure healthy environments, pay particular attention to children and other vulnerable people, make it easier to live a healthy life, ensure access to appropriate health services, and reduce health inequalities. In terms of constraints, public health should not attempt to coerce adults to lead healthy lives, minimize interventions that are introduced without individual or corporate consent, and minimize interventions that are perceived as unduly intrusive and in conflict with important personal values. Now, this is a loose set of principles that enables public health to continue to intervene. You might not agree with this, and that's fine. You need to feel out your own political and moral position on all of these matters. Let us introduce the concept of utilitarianism, which is an approach to ethics that's really quite straightforward in theory, yet rather more difficult in practice. Utilitarianism is a branch of a broader ethical theory called consequentialism. Consequentialism argues that the ethical validity of an action is based on the outcome of that action. So, in other words, the morality of an action is determined by its consequences. This contrasts with other ethical theories that morally evaluate actions on the basis of their intended consequences rather than outcomes. For example, most would agree that lying is wrong, but if telling a lie would help save someone's life, consequentialism says it's the right thing to do. Utilitarianism focuses on maximizing human welfare or well-being, which used to be referred to as utility. Utilitarianism states that the ethically right choice is in a given situation is the one that produces the most happiness and the least unhappiness for the largest number of people. Now, if you studied ethics before, you may have heard the phrase, the greatest good for the greatest number. Actions are good if they maximize pleasure and minimize pain for the greatest number, and in doing so, maximize utility. The theory of utilitarianism argues that it's the role of the government to maximize social good. So what does this mean in the context of public health? Well, it makes a lot of sense. We deal with populations, and therefore it's logical that we would want to allocate our resource wherever is likely to have the greatest impact. So you see, utilitarianism principles are never far from our thinking. Let's assume we've been awarded a large amount of money to work on influenza, and we are wondering how to spend the money to get the greatest health gain. Vaccinations are some of the most cost-effective interventions available, and we would prefer to fund research into vaccinations or interventions to improve vaccine uptake. But imagine a situation where we have the same funding, but in the midst of an influenza pandemic, with hospitals overwhelmed with critical patients. A utilitarian approach would be to continue on the path of expanding vaccinations rather than allocate the resources towards strained hospitals and supporting treatment services. Therein lies the problem with utilitarianism, since most people would consider this action profoundly wrong. If you take utilitarianism to its natural conclusions, we can end up in a world of eugenics and involuntary euthanasia. Utilitarianism is about the greatest good for the greatest number, and can easily be used as an argument that the ends justifies the means. But while utilitarianism could be the default ethical theory for public health, it's not enough. It misses some things that makes us human. In contrast to utilitarianism, which is useful for public health but has shortcomings, we now look at the concept of social justice. Social justice draws on some of the ideas of utilitarianism and has been suggested throughout human history. Renowned philosophers such as Plato, Thomas Aquinas, and Paine have all described the idea of a social contract between rulers and the ruled. The idea relates to concepts of justice and fairness. It was probably in the 18th century that the phrase social justice arose. The 20th century American philosopher and political theorist John Rawls is responsible for developing some of the most pertinent thinking about the social contract on something termed distributive justice. Rawls proposed a now famous thought experiment called the veil of ignorance. In it, he asks the thinker to imagine that they have no idea what class position or social status they are going to be born into. He then challenges them to describe what type of society or social contract they would want. Now, would you want society with unlimited opportunity for a privileged few, or a society with equal opportunity for all? It will not surprise you that everyone chose the more equal society. Now, you might conclude from this thought experiment that there is something inherent to us as human beings that cherished ideas of fairness. But you might go further and argue that we should seek to promote equality, perhaps even equity. Now, some people have taken the idea further still and they advocate for the redistribution of wealth or unconditional basic income. Now, wherever you potentially stand on this spectrum, you might be beginning to see how the idea of social justice emerges. Everyone in society deserves a chance. The idea of social justice converges with the idea of fundamental human rights. But how does this relate to public health? Well, the idea of social justice, of permitting a fairer society, underpins public health practice today. Our focus on reducing inequalities, on promoting health equity, is based on these fundamental principles. Social justice provides us with an argument, possibly even a moral imperative, to look after the most vulnerable in our society. Going back to the influenza pandemic example, social justice provides a justification for funding those much needed treatment services over supporting vaccinations, even if we know the return on investment in absolutely financial terms may be lower. In summary, social justice is the idea that everyone should have their fair chance. In today's world, the discussion is evolving into what that fair chance might mean. For example, there could be an argument that social justice means that older people's rights to expensive hospital treatment should be subordinated to that of a child who has not yet experienced that fair share of life. These are issues that you will face in your career as a healthcare professional. What is key is being able to understand them and articulate your own arguments, whether they may be on the basis of utilitarian thinking, ideas of social justice, or otherwise. Earlier, we mentioned that public health ethics differs from those used conventionally in clinical practice, as autonomy, non-maleficence, beneficence, and justice. Autonomy, or the right of the patient to make their own decisions, is perhaps the most challenging principle for us in public health. The idea of autonomy emerged as a reaction to what in medicine has been termed paternalism, the idea of the doctor as a father figure making decisions that they deemed were in the interest of their patient. There are multiple reasons for the rejection of paternalism, but perhaps the most salient is the emergence of technology and the reduction in information asymmetry between the doctor and the patient. Under early paternalism, a patient would know substantially less, if not nothing, about medicine compared to their doctor. But nowadays, with the internet and the use of WebMD and Wikipedia, patients have access to huge amounts of information. And so that information asymmetry is reducing. Other reasons for the rejection of paternalism are the upsurge in consumerism and change in society from one of adherence and deference to one of challenge. Many high-income countries are increasingly moving towards patient-centered care, where patients have increased choice, share decision-making responsibilities, and even play an active role in their own care. In public health, we don't have that individual relationship with the patient. Instead, the population is our patient, and our relationship with that patient is different. If you think about informed consent in public health, we are immediately and inherently constrained with what consent might be. population-level intervention may require a certain coverage to be effective, and achieving that coverage may not be possible without coercion. For example, herd immunity and vaccination. Society benefits from achieving 90% plus immunization coverage. Yet, in a busy world, and with social media platforms enabling the spread of misinformation and the like, there are strong utilitarian arguments for overriding individual autonomy and forcing patients or parents to vaccinate their children. The idea that children should be barred from attending school or public places, as has indeed happened in the United States, could result in adverse outcomes for the child. And remember, it's not the child who's making that decision. So whose wishes do we take into account? And when is it appropriate to make a decision for the greater good? The bottom line is that autonomy in public health is problematic. We do need a code of ethics that better guides those of us dealing in population health. There is no consensus on this, but we suggest reading the proposed principles from the American Public Health Association. They have 12 principles, but Jeffrey Swain's paper from 2008 builds these into 4 areas: interdependence, community trust, fundamentality, and justice. Interdependence is about achieving community health in a way that respects individual rights or recognizes that the health of some often depends on the health of others. Community trust is about developing and maintaining trust through communication, community participation, and collaboration. Transparency, maintaining confidentiality, cultural appropriateness, and obtaining the community's consent for interventions. Fundamentality is about focusing on the underlying and primary causes of disease, as well as the key requirements for healthy communities, including the physical and social environments. Justice is about ensuring that the conditions necessary for health are accessible to all, including the vulnerable, and of course, the disenfranchised. Swain's 4 areas are not completely different to the principles of medical ethics. They touch on autonomy, justice, and of course, helping others. But crucially, they are better suited to those of us working in population health.